Hey everyone, Jeff from Lewis Physical Therapy and Sports Rehab. We're going to talk today about the concept of one rep max testing, specifically to the high school or younger athlete, and really some other suitable alternatives, and really why I don't necessarily believe in one rep max testing for these individuals, and even for other athletes. Again, this is non-strength athletes. This is not talking about powerlifters. This is not talking about Olympic lifters. This is talking about field sport athletes more than anything. So when we look at one rep max testing, especially in the context of younger individuals, more often than not, these individuals do not have enough of a training ramp, meaning exposure, training background, training age is kind of the more technical term, to be able to support taking an all-out, pedal-to-the-metal, one-rep max test in a squat, deadlift, bench press. They just don't have, without getting too much in the physiology, they don't have the intermuscular coordination to support that level of lifting. And the other side of it is if they do attempt it and they fail at that rep, a missed rep, well, now we're kind of potentially getting into the kind of the confidence side of things more than anything. So when we're working with these younger individuals, we always want to look at ways that the ways we're going to put them in a situation where they are going to have small progress over a long period of time, which we're going to get to later, and it's going to keep them confident and wanting to come back and continue training. That's the biggest thing in keeping them consistent. So in a nutshell, that's why I just don't have guys do one rep max testing. There's a safety component. Now listen, if you are a much more high-level athlete and you find benefit in that, sure, but I've worked with plenty of high-level athletes and in high-level settings, and one rep max testing is not a part of that. I do think at a certain point in a career of a field sport athlete, it's not a matter of do you need to get stronger, is how strong is strong enough for you to perform at your sport, okay? So I'm not going to get too much more into that, but that's really why I don't think one rep max testing for the younger and high school population, especially, is really not an appropriate way to go about assessing their absolute strength levels. So when we look at alternative methods of it, and I kind of wanted to take this from the context of you have an individual that has not trained much at all. They don't have much exposure to kettlebells, dumbbells, let alone barbells, and how you go about getting from that standpoint there. So the first thing that we're going to look at for establishing kind of in the rep max world is establishing a five rep max. And in that case, I will use a very simple, just 5x5 routine. Now, before we even get to that point, say for a back squat or a bench and whatnot, depending on the individual, it might be they might have a year or two of just strictly GPP specific work. Now, all training is GPP, but I mean specifically just dumbbells, kettlebells, sandbags, med balls, jumping, sprinting. They might have 2 years of just that to the point before they even get to that point to a degree. That is very much dependent on the individual. But let's say you have the 15 and 16-year-old that has some good physical capabilities, but hasn't really committed to a really like sufficient training program more than anything. So in that case, if we just take on the top right corner here, let's just say we're taking 16 weeks to kind of work through this initial kind of extended on-ramp. That first month is going to be a GPP. That's a lot of sleds, work capacity, dumbbell, kettlebell, not much barbell work, but a lot more of the kind of calisthenic gymnastics work as well, and just getting exposure to different movements in different planes. Then we're going to get into our accumulation phase, where that's really our structural phase more than anything. We're going to have different types of force and contraction biases, some eccentrics and some isometrics at a lower level, especially if it's the first time we're going through that. But our goal there is we're trying to establish our 5 rep max. So your classic 5x5 routine. I think that, people are like, oh, it's too easy, it's too simple, it's not a good enough. But listen, it gets the job done in a lot of cases, and it can be worked for a long period of time, just staying in that 5s for some of these guys. So let's just say, again, all these are 4-week phases in our accumulation phase. We're going to take a 3 up, so I'll just kind of put this here. I generally take a 3 up, 1 down, so 3 weeks of progressive loading, 1 week of a deload, download, deload, whatever you want to call it. We're just cutting the volume and intensity or slashing the intensity and volume from that standpoint to allow recovery. So say we have 5x5 over those first 3 weeks, and we don't really have a number we're going off of. What I'm cueing people is, hey, listen, you have 5 sets here at your main work. You guys, you have 5 sets of your working set, or of this workout. Your first 2 sets are your warm-ups. And all of these should be progressively heavier in weight. Your first 2 sets are your warm-up sets more than anything. And then those last 3 sets, so that last 3x5, those are your main working sets. And I want you to focus on you're getting a little bit progressively heavier on each of those sets. And you're working up to that 5 rep in that first week where you're not taking it to the well. It's not an all-out to failure. I don't want any of this to be to failure. You are leaving 1 to 2 reps in the tank, but you're getting some good intensity under that. So the goal is we're kind of looking at it from the kind of 3rd week, that last week kind of in earshot from the standpoint of that's our main test week there. So we don't want to just empty the tank on week 1. And this is where the coaching side of things comes into play, knowing your athlete and kind of going from there. So that third week is that last kind of set on that third week is, all right, listen, this is our 5 rep max we're going for. We're at a certain weight. I want you to get a good, hard 5 reps here, not to failure, no missed reps. You're leaving at least 1, preferably 2 reps in the tank. So once we have that number, we're then going to use what we call the Epley formula, and you can throw this into Google and it'll pull up the formulas and whatnot. It's a formula we use for an estimated 1 rep max. It's not the most accurate when you get higher, but it gets the job done from these standpoints. Then you can kind of pick and kind of manipulate it as need be in terms of what you're seeing in front of you, bar speed, and the athlete and whatnot. So we use the Epley formula for an estimated 1 rep max. Now this is where the concept of the training max comes into play. When people get their estimated 1 rep max, they think that is what you want to go off of for all your percentages after that. I prefer, and a lot of people out there, there's a lot of good like higher level lifters that go off this. They go off your training max, which is roughly, not always, but roughly 90% of this estimated 1 rep max. Now the reason that we do this is, for most people, if they try to live in that very higher percentage range very consistently, they're going to get to a point where they are going to start missing lifts. They're not going to be able to push forward. There is a lot of benefit of getting really good at moving submaximal weights fast. And I'm not saying submaximal like 50, 60%. I'm saying upwards of 70 to 85 and 90% from that standpoint. But the reason we use the training max is we are going to be able to put ourselves in a position, put the younger athlete in a position where they are making all their lifts. They're getting good quality reps. That's the other thing. They're getting good quality reps at those lifts. And more than anything, we're accumulating good volume over that time without the missed reps. Because again, when we start missing reps, we're going to talk to down here. There's a confidence piece of it that's affected. There is a standpoint of you might be exposing them to too much load, and are they not going to be able to recover from that standpoint? So a 90% of a training max is a really good option to go from that standpoint. And you can manipulate that. If you have a guy coming off of injury, you maybe want to go a little bit lower, 80 to 85%. And the reason being is we want to look at this from a long-term standpoint. So, perfect example. Say in this week of 5x5, you hit a trap bar, deadlift, 350 for 5 reps. Still had some left in the tank, but it was a good hard set. You're then going to take the estimated 1 rep max using the Epley formula. That estimated 1 rep max is going to be 408 pounds. You are then going to take 90% of that 408 pounds, and your 90%, which is now your training max, is 367 pounds, 368. I mean, you can round up 370 if you need a clean number. But that's our training max there. So now, when we go into our next block, everything we are basing our percentages off of is this number. So say I get to my strength block. My first week is, 3x5. We're going to 3x5 at 80%. It is 80% of this number, 367, not 80% of 408, okay? So that's important to distinguish from there. Now, different methods of determining how you got stronger. Rep maxes versus max reps. So rep maxes is your 5 rep max, your 3 rep max. So when we look at this standpoint here, and then max reps is max reps at a certain weight. So say you run through that first accumulation block, you hit a 5 rep max at 350, and you then go on this next block on that third week, you're going for max reps at 350. Well, if on that third week here, if you hit 350 for 8, but you previously did 350 for 5, you got stronger. So there are plenty of ways to determine whether you have gotten stronger versus an all-out 1 rep max testing with really poor form. And then again, the rep max is more than anything. Maybe that's in your next block here, where that second or third week, you go, okay, I'm going to establish a new 5 rep max. So say you go for a 5 rep max here, and you get 380 for 5. Again, you hit 380 for 5 here. 8 weeks ago, you hit 350 for 5. You got stronger. So that's a way that we go about doing this. And again, I know I'm talking about this from the standpoint of younger athletes, high school athletes. This goes for adults too. Like, I don't really believe in, nor do I believe in, adults having to go for heavy 1 rep max testing. I've seen a lot of injuries, too many injuries in my practice come from that standpoint. So, and just from a personal experience. So that's why I like to go from these alternatives. Now, what I will say is, in this standpoint here, I have it where, hey, you do max reps on this block, rep max here. You can blend them. So you could go, week 2 is max reps, week 3 is rep max. Like, the last point here, and this is really the main reason why we go at this approach, is small progress over long periods. Everyone wants to know, how do I get stronger in 4 weeks, 8 weeks, 10 weeks? When you're working with a younger athlete, I do not care about the progress you can make in 8 to 12 weeks. I care about what you can make over a long period of time, 1 year, 2 years, 3 to 4 years, setting you up for college. Missed lifts Missed lips are not a good thing. That's poor patterning. It hurts confidence. We want to keep them coming back to the weight room. So get out of the mindset of, I just want to look at training as this short period of time. You need to look at it from a long-term athletic development standpoint. We talk about that all the time, but that is really what it is in its kind of in a nutshell. And the way that you look at it and go about it smartly is from this approach here. Now, there's a lot of other stuff that goes into this: plyometric sprints, assistance work, conditioning, mobility, all that stuff. But this is strictly from the 1 rep max testing or rep max testing alternatives, because I do think this typically carries a higher risk of injury than others, because it just does. I know from personal experience what I've seen in the clinic as well. So if you have questions on this topic and how you go about navigating your own training, drop them below in the comment section or subscribe to our channel for more content like this.